and welcome. You're watching COVID-19. Korea recorded unprecedented numbers of new infections this past weekend, and authorities are working to better respond to this latest alarming surge in daily cases. They're also sharing their fourth quarter vaccination plan, and we have details on that in this edition. Here first are the pandemic updates with our Kwon So-ah. So let's begin here on the local front for this Monday.
Sunny, since the end of last week, the after effects of the Chuseok holidays have started to show. Now, considering the incubation period of the coronavirus, which is around 2 weeks, the aftermath from the actual holiday season is even likely to lead to a further rise in cases, as the current figures may reflect the rise in movement that was already here before the holidays. And the number we are seeing this Monday stands at 2,383 as of 12 a.m. and that includes 2,356 domestic transmissions and 27 cases from abroad. Now, Korea is now the country with the 77th highest number of infections around the world and has surpassed the 300,000 mark over the weekend, now at above 303,000, with 2,456 COVID-19 related deaths, and also almost 32,000 people are currently under treatment or in quarantine. Now, the average number of daily domestic transmissions in the past week also stands at way above 2,200, as you can see. And this is because infections in the past week have been lingering at above 1,600 to above 3,200. Now, this is the all-time high that Korea has posted on Saturday. And also the number we're seeing this Monday, this is also the highest figure we're seeing on a Monday. This number is also, this is an on-week jump by around 800 cases compared to the week before. Now, cases are also rising continuously outside the capital region. As of this Monday, 12 a.m., almost 30% of cases have occurred outside the capital region. So for a closer look at the figures by region, over 700 cases in the capital Seoul and Gyeonggi-do province, and a triple digit not only in Incheon, so not only here in the capital region, but also here in Daegu and Gyeongsangnam-do province, with over 100 cases in these places. And let's also take a look at the vaccination figures. We are expecting these numbers to pick up speed in the fourth quarter of the year. Now, currently, we've got over 38 million people here who have received at least one dose of COVID-19 vaccine, and 23.2 million people are fully vaccinated. Let's move over to the global figures now. The total number of cases around the world stands at almost 232.6 million, with some 321,000 cases added in the span of 24 hours as of noon Korea time. If we move over to the countries worst hit regarding accumulated cases, Turkey over the weekend has hit more cases than France in total, and Malaysia has become the country with the 20th highest number of infections around the world. So now another Southeast Asian country that has been added to this list. And those are the updates I have for now. I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, meanwhile, a growing number of vaccine makers believe the pandemic will be tamed within a year. For more on this optimistic outlook, I have Kim Sung-yeon with me in the studio. Sung-yeon, welcome.
Hello, good afternoon.
Right, so there is tangible talk about a possible ending to this global health crisis, Sung-yeon.
Well, I mean, for us here in Korea, it does seem like a distant dream, as I mentioned with about the record surge here in Korea. But nevertheless, the makers of the COVID-19 vaccine are forecasting that the pandemic could come to an end sometime next year. Now, this is according to Moderna's chief executive, who added that a boost in production will mean enough vaccines for everyone in the world by then. Stefan Bancel was speaking to a Swiss newspaper in an interview published last Thursday, and when asked whether that meant a return to normal next year, he responded by saying he assumes so in a year's time. He said with the industry as a whole expanding production, there should be enough doses available by the middle of next year to vaccinate the entire globe. Experts, however, point out that whether his predictions would come true is likely to depend on narrowing the vaccination gap between the rich and poor countries.
Right. Now, Song-Yeon, earlier on there had been talk about COVID-19 becoming endemic, right?
Right. So there had been these predictions made previously by several health experts here in Korea and also abroad. And they have been echoed this time by Moderna's boss, who said COVID-19 could become similar to the flu and that boosters may be needed every 1 to 3 years. Now, Sarah Gilbert, the co-creator of the Oxford AstraZeneca vaccine, also predicts that COVID-19 may become endemic, and the British scientists added, however, that the virus probably won't mutate into an even deadlier strain that can evade vaccines. Also on this note, Professor Sharon Peacock, the executive director of the COVID-19 UK Genomics Consortium, noted that the 4 major COVID-19 variants, they all emerged before the vaccination program started, and that it is pretty quiet since the Delta variant was identified. Moreover, former U.S. FDA chief Dr. Scott Gottlieb was quoted as saying to CNN that he thinks the Delta wave may be the last major wave of infection and that COVID-19 could fade into the background as a seasonal illness. Now, all these experts once again underscored the importance of vaccinations to stay on top of further vaccine-resistant mutations.
Right, Song-Yeon, and against that backdrop, what is the outlook for Korea?
Well, I mean, authorities say it is certainly too early to be talking about any sort of end game scenarios here. But Prime Minister Kim Boo-kyum did say on Sunday that Korea will be able to embark on a phased return to normal starting in late October as planned. Kim made the remarks at a forum Sunday as the country plots an exit strategy from the pandemic, especially with the small businesses struggling to cope with the financial strain of COVID-19 restrictions. He said by late October, 70% of the entire population will have gotten fully vaccinated, which would allow the country to begin preparing for a gradual return to normal. The KDCA commissioner, in the meantime, emphasized the importance of stabilizing the outbreak in order for the transition to take place. Let's take a listen.
The KDCA would like to stress that a phased return to normal life will only be possible if our containment efforts can hold up until the end of October, when more than 70% of the population will be fully vaccinated.
Right, containment efforts. So I suppose tackling the potential post-Chuseok repercussions would be a starting point then.
Right, that's the most important. We have been seeing a huge spike in the infection rate following the Chuseok holidays, with the Prime Minister thus asking the public not to venture out and socialize throughout this week. Now, Prime Minister Kim said the post-holiday surge is very grave and worrisome, saying the country's containment efforts this week will be the key in determining the starting point of our return to normal. He also touched upon other positive signs that could help us get this process started.
Even with a sharp rise in cases, the rate of deaths and hospitalizations are on the decline, thanks to our vaccination campaign picking up pace.
But even as the transition gets underway, Kim highlighted that people still should wear their masks and abide by other rules. And he added that if a COVID-19 pill is rolled out at the end of the year in the U.S. or elsewhere, the world could enjoy another advantage in the fight against the pandemic.
Right, Song-Yeon, hopefully that will be the reality. All right, thank you for that coverage.
The pleasure is mine.
Moving on then, as Song-Yeon mentioned, efforts this week then to tame the current spread here on the local front will be pivotal in deciding the latest spread in the country. Am I right, Soa?
Indeed, Sunny, and it is likely that we may even see another record high figure this week past the Chuseok holidays, which is why in the near future we are not expecting any easing in strict prevention measures. In fact, according to an official this morning, he told reporters that by Friday there are expected to be an announcement on social distancing measures, which are currently at level 3 and level 4 here in the capital region. So we are expecting that maybe for another 2 weeks beginning next Monday, these measures will remain in effect. And also, let's take a listen to the recent assessment by the government on the current situation by Prime Minister Kim Boo-kyum on Sunday.
We expect to continue seeing the after effects of the Chuseok holidays throughout this week. Considering the incubation period of the virus, the spread in the capital region has yet to be curbed, and infections in areas outside the capital have been on a rising trend after the holidays. How we contain the virus this week will determine the starting point of our gradual return to normal. If you have visited your hometowns or gone on vacation, please visit a nearby test site before returning to your workplace.
Also on the weekend, the chief of the Korea Disease Control and Prevention Agency, Chung Eun-kyung, had a forecast for beyond this week.
With another holiday coming up, we expect another rise in movement in early October. That's why we ask you to cancel or delay private gatherings for at least 2 weeks and refrain from visiting venues where it's difficult to keep a mask on.
Now, Chung just mentioned that one holiday, but there's also another holiday coming up. So we're having actually 2 back-to-back extended weekends next month.
Right, and also next month, so a greater proportion of the public becomes eligible for COVID-19 inoculations, right?
Yes, Sunny. So briefly, a rundown on what's expected for Korea's vaccination program in the 4th quarter of the year. The government is expected to increase the vaccination rate further. Now, first, by narrowing the interval between the first and second doses of mRNA vaccines starting early October, which had been extended to 6 weeks from the initial 3 and 4 weeks for Pfizer and Moderna vaccines, respectively. The Prime Minister on Sunday called on officials to make sure there's no room for confusion for people wanting to shorten their jab intervals from their original schedule. Vaccinations will also be expanded to teenagers aged 12 to 17, as well as pregnant women. Meanwhile, the first booster shots will be administered to seniors aged 60 and above and people at high risk of infection, such as medical staff. And the need for booster shots is in particular being emphasized in the wake of more breakthrough cases recently. As of Saturday, 969, or almost a quarter of breakthrough cases were among people aged in their 30s, followed by almost 24% in their 60s and 23.6% in their 70s. So that may also lead to further discussions on whether we have to expand those booster shots to a variety of age groups.
I see. All right, so as always, thank you for the detailed local update.
My pleasure.
Right, authorities elsewhere are seeking ways to address vaccine hesitancy among their healthcare workers and its potential toll on the medical system. Our Ji Abili is here with details on that. Ji, hello.
Hi, Sunny. So in today's segment, let's start in the United States and then later go over to India. New York Governor Kathy Hochul is considering employing the National Guard and medical workers outside of her state to fill hospital staffing shortages. The decision comes as tens of thousands of workers are in danger of losing their jobs for failing to meet the state's COVID-19 vaccination deadline by Monday. Hochul outlined the plan in a statement over the weekend, which allows her to declare a state of emergency. Now, under that condition, she can increase the supply of healthcare workers to include licensed professionals from other states and countries, as well as retired nurses. Hochul said the state was also looking at using National Guard officers with medical training to keep hospitals and other medical facilities adequately staffed. The governor's office said some 16% of the state's 450,000 hospital staff, or roughly 72,000 workers, haven't been fully vaccinated. Hochul's office also warned that healthcare workers who are fired for refusing to get vaccinated will not be eligible for unemployment insurance. That is, unless they're able to provide a valid doctor-approved request for special medical accommodation. As you know, the U.S. is grappling with the problem of a large number of workers opposing vaccine requirements. The global vaccination rate hovers just over 32%. The figure for the U.S. and Korea are 56% and 45%, respectively.
Right, and staying in the US, I believe Prince Harry and his wife, Meghan Markle, were also in New York over the weekend. Tell us more about that.
Sure. So the couple was speaking at the Global Citizens Festival on Saturday and highlighted the need for vaccine equity. They expressed regret that so much of the global COVID-19 vaccine supply is being used by so few countries.
My wife and I believe that where you're born should not dictate your ability to survive.
Especially when the treatments exist to keep you safe.
So, global citizens, we ask you tonight Do you think we should start treating the access to the vaccine as basic human right? I don't think they heard you. Thank you.
The couple said they have learned from experts and global health leaders about how they can contribute to help end the pandemic, calling it a battle of misinformation, bureaucracy, lack of transparency, and access. The couple left their royal duties last year and moved from the UK to the US state of California. The aim of the Global Citizen Live concert is to push for greater action on climate change and urge rich countries to share 1 billion doses of COVID-19 vaccines with nations most in need.
I see. Now, Ji, you mentioned India at the start of your segment. What's the latest there?
Things are not looking very good there. About 90 new COVID-19 cases were reported in the past 10 days in India's northern city of Dharamshala, near the country's border with China's Tibet Autonomous Region. As a result, the district administration declared the Nobulinka Monastery as a containment zone. A total of 88 exiled Tibetans, including some monks, have recently tested positive. Now, of that number, 35 cases were reported in the monastery itself. The government in exile has been functioning in India since 1960 after the current Dalai Lama and many others fled Tibet following a failed uprising there in 1959. India reported more than 28,000 new COVID cases and 260 deaths on Sunday.
We have a task force for the COVID, and as for the result is concerned, numbers are picking up because one thing is that there is a rigorous kind of checks going on within the communities so that we can prevent further contaminations or further the prevalence of the disease.
That's all for me today. I'll be back same time tomorrow.
All right, Jay, see you then. Right, on a slightly bright note now, with the local vaccination drive in steady motion, there is a subtle sense of growing hope for a tangible return to normality. Well, that hope appears to be taking shape among senior Koreans, whose inoculation rate stands at above 90%. Do take a look.
More than a year and a half into the pandemic, there's a growing sense of longing among people in Korea for a return to their normal routines and activities. A recent survey has shown that more than 70% of Koreans are in favor of a transition in the country's COVID-19 response away from a complete eradication strategy. Korean health authorities say at least 80% of all adults and 90% of the elderly must be vaccinated in order for this transition to take place.
감염 후의 사망률이 이 60세 미만 사망률과는 10배, 100배 차이가 납니다. 그래서 고령자에서의 사망 위험을 줄이기 위해서 예방접종은 매우 중요하고요. 어떤 백신이라도 감염의 예방은 좀 차이가 날 수 있습니다만 위중증이나 사망으로 가는 거의 예방 효과는 다 80%, 90%로 다 유지되고 있기 때문에 예방접종은 사망률을 줄이는 데 있어서 매우 중요한 효과적인 수단입니다.
Korea has so far vaccinated more than half of its adult population and 86% of its senior citizens aged 60 and above. For many elderly citizens who got vaccinated early, they're beginning to get a taste of normal life, which they had enjoyed before the pandemic. Here, we're at a fitness club in central Seoul. The center reopened its swimming pool recently, with access limited only to club members who've been fully vaccinated. They're given these green wristbands to wear, showing that they've completed their full 2-dose vaccine regimen. With the band in place around their wrists, the elderly fitness club members are free to go for a dip at the swimming pool here.
안 맞는 사람도 많이 있어요. 나는 아니야. 그건 맞아야지. 맞고 이렇게 편하게 있는 게 낫지. 안 맞은 사람들은 지금 활동을 못 하잖아. 근데 이걸 맞고 나니까 편하지. 자신감이 생기지.
이제 코로나 백신을 전부 다 접종을 완료하시고 이렇게 나오시는 건강한 모습으로 나오시는 거 보니까 저도 기분이 참 좋습니다.
Statistics show that vaccinations have had a substantial effect in the health outcomes of elderly COVID-19 patients. Of the COVID-19 cases among the elderly reported in Korea between the months of April and August, the death rate among fully vaccinated patients aged 60 and above stood at only 0.5%, compared to 2.5% for those without immunity.
국내에서 예방접종을 시작할 때부터 저희가 그 과학적 근거를 가지고 결론을 내린 원칙이 세 가지가 있습니다. 하나는 고위험군에 대한 접종을 최우선으로 한다. 특히 집단 생활을 하는 고위험군이 가장 먼저 맞아야 된다라는 게 첫 번째고요. 그중에 첫 번째 고위험군에 대한 접종을 진행을 함에 따라서 어르신들이 이제 접종을 했고요.
Thanks to the vaccines, many elderly Koreans now have much less to worry about when it comes to COVID-19, and have also been able to break free from the sense of distance and isolation.
코로나가 빨리 종식이 돼가지고 자유스럽게 좀 모이고 돌아다니고 그렇게 했으면 좋겠습니다.
The longing for activities that we used to take for granted is a sentiment that is shared by everyone, and vaccinations remain the only feasible option we have to return to our normal pre-pandemic lives.
향후 1-2주간은 확진자가 크게 증가할 수 있고 또 10월 초에 연휴 기간에 이동량이 다시 늘어날 것으로 예상되기 때문에
무엇보다 예방접종은 본인 의사에 따라서 시행되는 것이므로 학교에서 접종을 강요하는 분위기가 형성되지 않도록 살펴봐 주시기를 부탁드리겠습니다.
60세 이상의 고령층, 의료기관 종사자 등 고위험군부터 추가 접종, 이른바 부스터샷을 시작하겠습니다.
Authorities this past Saturday announced over 3,000 new infections nationwide, a record high for Korea since the start of the pandemic. What's more, a significant number of these cases, these latest cases that is, remain untraceable, raising fears about a relentless rise in transmissions in the days ahead. For more on the local situation, I have Professor Chung Gi-seok from Hallym University. It's a pleasure to have you back, Professor Chung.
Thank you for having me again.
I also have Professor Kim Eun-gyu from Yonsei University. It's good to see you again, Professor Kim.
Thank you for having me.
Right, Professor Chung, how do you explain the frightening rate of transmissions here on the local front over the past week?
Well, it's far more than I expected about 1 or 2 weeks ago. There could be some explanation for that because we have already seen an increasing tendency before the beginning of Chuseok holidays, a bit higher. Then this is a continuum of increasing tendency after Chuseok holiday. This is not the result of mixing of people between capital and non-capital area during Chuseok area so far. We will see the result of that kind of mixing this week. And during a Chuseok holiday, epidemiology investigation was not very active and somewhat postponed. And during that time, still we saw lots of confirmed cases. And close contacts were informed after the holiday. So last Thursday, Friday, and Saturday, many close contacts were informed and they got the examination. And that's why we are seeing over 3,000 and over. And as we know, we have two weapons in the battle against COVID-19. One is the social distancing and the other one is a vaccine. Social distancing is not active anymore because we have been in the same level for more than months and 2 months. The vaccination, I thought it is working. Just before the holiday season, I thought there was some balance between a vaccination and increasing tendency. But now I can see the vaccination is not very active, very strong in suppressing the current situation. So maybe there will be an up and down of confirmed cases until we have more vaccinated people who have more immunity against COVID-19.
Right, and the plan is to have everybody 70% of the population fully vaccinated by the end of October, right? And keeping in mind what Professor Chung has said, Professor Kim, how long do you expect this worrying trend to last?
First of all, I would look at the outbreak in Garak marketplace, because one of the good example what happened during Chuseok time. Actually, there was a small cluster outbreak about 2 weeks before Chuseok, and there are a few cases, and they did the full investigation for any people exposed. They even have to stop the auction for fruits and vegetables for 3 days, which is the first time ever Garak marketplace had done that. I think it started from a friend of a worker, and it spread to more than 600 persons, and they had to do more than 25,000 PCR tests. And I think it's a good example of what they're facing right now. And why could not stop this? We already knew that something is happening in that marketplace, and eventually it became worse. I would like to explain a case that I encountered in the emergency department a few days ago. There was a person who got vaccinated. He was on self-isolation for 2 weeks. Nothing happened. But after that, he started to have symptoms, and which turned out to be positive for COVID-19. So there are some exceptional cases having longer incubation period, maybe exposed to another case. So it becomes very multifactorial right now. So if I return to your question, are we going to have more patients like 4,000, 5,000? Nobody knows, and we have to do our best and pray that it would not reach 4,000.
Right. And Professor Chung, current social restrictions will come to an end on the 3rd of October, that is on late Sunday night. What do you recommend as part of containment efforts for the weeks ahead then?
Well, I don't think government will ease the current social distancing level, both in capital area and non-capital area. Because we don't anticipate how much confirmed cases we'll have in weeks to come. But I'd like to emphasize the 2 parameters particularly. One is transition to critical care status. Current status is 2%. Is 2 out of 100 confirmed cases go to an intensive care unit, and some will die of COVID-19. That is a very high rate of transition rate, and the other one is fatality rate of that each cases. So if you see those kind of parameters decreasing by fully vaccinated cases, then we could, if we could see 3,000, 4,000, 5,000, that doesn't matter. So you can keep current social distance measure if you see a bit decreasing tendency of severe cases and fatal cases. But if you cannot see those kind of rate decreasing, then you have to increase some kind of social distance measure, and you need a stronger measure in the battle with COVID-19. If you do not do that, we'll see, say, 5,000, 10,000 people, and 2%, about 1% going into ICU unit. And we don't have very many ICU units in Korea. We have only 8,000 ICU units in Korea, and 5% are used for COVID-19. If you have many patients with the same rate of transition to a critical care unit, then let's say about 10% of ICU unit will be occupied by COVID-19. Then there could be another disaster for other diseases suffering from very critical care conditions. So that will be a destruction of medical support system by that time. So government need to handle, at least prevent that kind of disaster.
I see. Professor Chung, at the moment, I believe we have slightly above 300 people in intensive care. What number should that figure fall to for us to believe that we do have some sense of strong containment over COVID-19 then?
Well, there's no measure to decrease that kind of one. The only way is to get as many vaccines as possible to all people. But we still have a hope for that because we have oral antiviral agents maybe coming out in the market in the end of this year. In that case, we'll strongly expect and hope that we'll see a lesser number of patients are going into intensive care unit.
Right. Professor Kim, authorities on this Monday have also shared their vaccination agenda for those aged 12 to 17. Now, what are your words of advice, perhaps, to their guardians who would like to perhaps make informed decisions on this matter?
I would like to look at other countries first, and we know that the European Medical Association approved Pfizer and Moderna for age 12 to 16, and both showed immunity against COVID-19. The case about 2,000 and 3,000 compared to control. We also have a report from Harvard University that there was about 1,000 cases of myocarditis out of 300 million doses of RNA vaccination. So that means it's not that worrisome. And when we look at more closely to European countries, for the age group 12 to 18, Spain already done vaccination for 80% of that age group, and Italy and France about 60%. Germany is a little bit low in vaccination rate, ranging about only 30%. And one more country, Sweden, is already finished their 12 to 16 age group about 75%. So they're also waiting for approval, and my opinion, it's definitely vaccine is going to need it for high-risk patients in the age group 12 to 16, and definitely there's going to be more benefit than harm. But everybody's considering Pfizer, but I would like to say that we should open the window for other vaccination, which might be more safe and also effective for that particular age group.
I see. Are there any vaccines that you have in mind? Are we talking about inactivated
Well,
virus vaccines?
yeah, as Professor Chung mentioned, we have Novavax coming out late this year, and also we have to compare more closely between Pfizer and Moderna, which vaccine has a longer period of action and less side effects for that young age group.
Right. Professor Chung, as Professor Kim mentioned, there are calls for restricting inoculation to minors at high risk, or perhaps offering them single doses of the Pfizer vaccine. What are your thoughts on this?
Well, I'm not a pediatrician, I'm an internist, but my thought on that is the age 16 and 17 is okay. It is fully certified by FDA in USA, but 12 to 15 is only for emergency use authorization so far in USA. Even though Korea FDA approved the use of Comirnaty, which is Pfizer vaccine in Korea, and Korea KDCA would accept those recommendations. But I'm still have a doubt on the safety issue because the vaccine efficacies are very good. There's no doubt on that. But the safety comes from very many cases of vaccination in general population. Dr. Lee mentioned there are many countries, some countries who have vaccinated in those age group, but I don't think it is safe enough. So I need more information about the side effect or adverse event of mRNA vaccine in those age group because they are actively growing population, And nobody knows midterm or long-term adverse event with that kind of vaccination. So if the risk is very high, I agree that you need vaccination in those young groups. But if the risk is not very high, like in Korea, you have to weigh for the risk and benefit of those vaccines, particularly in younger population.
I see. Professor Kim, Korea's fourth quarter inoculation plan also includes pregnant women now. What has been shared about the safety of COVID-19 vaccines for expecting mothers and their babies?
First of all, we have to know that symptomatic COVID infection in pregnant women is risky. They belong to the high-risk group. And from the report from CDC, they said that RNA vaccination for pregnant women had some effects. The number of the study was about 4,000 cases, and 86% ended up normal delivery, and 13% had a miscarriage before 20 weeks of gestation. The only side effect was the pain on the injection site compared to control group. So that means the vaccine was relatively safe. And there's an additional report from USA that studied about 36 cases. They say the vaccine induced immunity against the COVID-19 for the mother and also for the baby. So that means it's promising. And if you visit the Johns Hopkins website, they show the data telling that there are more than 200,000 pregnant women had a vaccination. And they say there's no problem with the breastfeeding, and no problem with the fertility, and there's no increased risk for miscarriage. So that makes that as a green light for vaccination for pregnant ladies. One thing in particular I would like to mention is the European Medical Association say that they recommend the vaccination after 12 weeks of gestation.
Right, so not in your first trimester.
Yeah, not in the first trimester.
I see. Professor Chung, the green light, as Professor Kim has used, has also been granted, that is, for booster shots here in the country in the fourth quarter. Do you see these extra doses as perhaps better reducing the breakthrough infections that my colleague Soa mentioned earlier?
Well, yeah, I believe the booster will decrease the kind of breakthrough infection or severity and etc. There is many proof from each companies who have produced the vaccine, the Pfizer, Moderna, AstraZeneca, even Johnson & Johnson has their proof of antibodies increased after the booster injection. And they could prevent further severity, and they could prevent death from COVID-19. But as we know, the US FDA approved a booster shot only in 3 categories: who are over 65 years old and who are between 18 and 64 under 2 conditions, have underlying diseases. And also we had underlying disease and also have a high exposure risk rate. So that means doctors and nurses who are working in the hospital who meet COVID-19 patients. So the reason why that is because there is still no big data evidence that booster will clearly prevent the infection in general. It is clear the antibodies increase, but the increased antibody is not all in preventing infection. As we know, you have T-cell immunity and memory B-cell immunity. That is nothing to do with the current antibody titer in your blood. So if you have a lesser amount of antibody, then you attacked by COVID-19 virus, then the memory cell rapidly produce same kind of antibody in hours and in days. So that's not a big risk for that. And T-cell immunity is not also measured when you account for effect of booster shot. So that's why quite many scientists over all the world are concerning about too much of a booster shot in developed countries. So we have to see, and then we have to wait more data to come.
Right. And staying with booster shots, Professor Kim, what has been disclosed about the vaccines to be used here in the country and the manner through which they will be delivered? Do we have much information on that?
Actually, there's no well-designed study for booster shots yet. I mean, when they first developed any kind of vaccine for COVID-19, maybe they were thinking about booster shot, but it was not announced publicly. If it works well, why do we need booster shots? And when we look back the history of vaccination for children, it started with 1 dose, then they say it's not enough, 2 doses, sometimes even 3 doses. And after that, they recognized that the effect of vaccination declines after some time or period. So then they came with the first booster, second booster. So I think it's working out that way in a short period of time for this COVID-19. Mainly, booster shots is considered to give RNA vaccination, but UK approved AstraZeneca for vaccination, and then also Johnson & Johnson approved that their vaccination for booster, which boosts immunity up to 94%. Any kind will work. And one more thing we have to consider is that Pfizer is considering to give the same dosage as the first 2 shots for booster, but Moderna is considering only half dose for booster shots. So whatever, we have to see the final results for that. But finally, I would like to mention one more thing about this booster issues. We have to think globally because there are still many blind spots in the world map. I mean, Delta variant came into Korea, and now we're facing the fourth outbreak, and nobody knows whether we're going to have another one from maybe Africa, from other Asian countries, and they didn't even start the vaccination for most of their population. So the priority should be for the high-risk groups, and then as we got some vaccination from other countries, from Israel and from some European countries, we might have to think about giving our storage to other countries we need desperately for the vaccinations.
Right, as we are doing so with Vietnam, of course.
Yes.
Professor Chung, amid plans for a phased return to normality starting late October, that is, there are questions about the management of the country's unvaccinated adult population. What are your words of advice?
Well, those unvaccinated population has their own reason why they do not get a vaccine. Many of my patients in my clinic says that they are quite worried about adverse event, of course. They believe that the vaccine is effective. But if you suffer from adverse event, then sometimes it is it's an agony for them. So first of all, people were afraid of blood clotting by AstraZeneca vaccine, and then mRNA vaccine caused myocarditis, and both vaccine caused anaphylaxis. It's quite often. And government used to report the cause of death among vaccinated people was because of underlying disease. They didn't specify any kind of complication due to after hypertension, complication of cerebral hemorrhage, and that's the cause of death. That is a full story. But government only reported that having an underlying disease was the cause of a death. So people, the patients in my clinic all have underlying disease. So they keep saying that because I have an underlying disease, I'm a high-risk population among, then I could die because of a vaccination. So I persuade them continuously, but sometimes they deny getting a vaccination. So sharing very correct and frank information with whole populations is very important. And sometimes vaccine incentives will encourage them to get the vaccine. So I have to say that no one is safe before everyone is safe. To be safe is getting a vaccination. So please do get vaccinated if you are not unvaccinated.
Very important words right there. All right, Professor Chung, as always, thank you very much for your thoughts. Professor Kim, thank you very much for being with us today.
Thank you.
Right, well, that brings us to the end of this edition of COVID-19. Do seek to do your part in containing the pandemic by abiding by all prevention measures. Thank you for watching and do join us again on Tuesday.